Everyone. This presentation concerns creating health. During this presentation, I'm going to mention some scientific details in a simple language so that the normal person can easily understand. It will take some time, however, it's very important for you to understand how to create your health. The definition of health. What's health? Health does not mean that you don't have a disease currently. And if you do blood test, if the blood test comes normal, this does not mean that you are healthy, because our body reserve can keep us from getting a chronic illness except in late stage. So we need to know what is the current stage of vitality, and this is done through understanding many concepts. We need to understand the inflammation, if the person have inflammation in his body or not, if he has been suffering from exposure to toxins and his body is now under toxic load. What about his lifestyle, his diet and exercise and his sleep, and if he is meditating in the sense that he is relaxing his mind or no, and what about his genetic makeup. Genetic makeup is important, however, we can't do everything without studying the genetics, and the importance of genetics here lie in the fine-tuning of our approach. All these factors influence the long-term health of the person, and if he is prone to have complex chronic diseases or no. Now, what are the prerequisites to optimum health? So what I need to have optimum health? I need to optimize many systems in the body. These systems are interconnected, that they share the same information among each other. The immune system, we need to know if the person has chronic inflammation or no, and how to fight chronic inflammation. By the way, during this presentation, I'm going to give solutions. I'm not going only to give you scientific information, but I'm going to give you solutions with each step of these steps. So the person need to have optimized immune function. He has to have a detoxification system working properly, proper energy production, optimal energy production, balanced gene activity, because some people, and this is very common, have genes which are hyperactive and genes who are hypoactive or less active. Both of them are in the wrong direction. We will go to this during our presentation. And the epigenetic milieu, epigenetics means the forces that control the gene. We will talk about this also. Regarding the hormones and chemical transmitter levels, exercise and stem cells, we will keep it for next presentation. Now we're going to talk about chronic inflammation, its causes and effect, and how we manage the chronic inflammation. Now, what is the meaning of chronic inflammation? Chronic inflammation is different from acute inflammation. Acute inflammation, for example, somebody get tonsillitis or acute bronchitis or abscess. These are time-limited inflammation that cure by itself within 1 week or 2 weeks. However, chronic inflammation is lifelong process that happens every day and every hour. For example, we will go to the gut, the intestine. The gut microbiomes, the bacteria that live in the colon. These bacteria can be healthy bacteria and secretes short-chain fatty acids. This one. These short-chain fatty acids, if the bacteria is healthy bacteria, it will be supportive to the immune system, and I'm going to tell how. However, if the gut microbiome or bacteria is not healthy, it's going to secrete gram-negative lipopolysaccharides, which is the membrane of the microbe. When the microbe die, its particles or its membrane is destroyed and become small particles. If these particles get access to the bloodstream through leaky gut, it will meet the macrophage. Macrophage is type of immune cells. We call it the innate immune response, which is the first thing that meet the microbe when it enters into the circulation. This macrophage, if identifies these lipopolysaccharides, which is part of the microbe, it consider it the microbe itself, and it will send messages, chemical messages, to the lymphocytes in the blood, telling them that get ready, we are going to do a fight, or we are going to fight an infection. And this creates a state of chronic inflammation in the body. This chronic inflammatory states is very bad for two reasons. Number one, it devitalizes the tissues. Number two, it consumes the body efforts in fighting inflammation rather than reserving this effort and this energy to build the tissues. So the chronic inflammation can affect the brain. That's why in patients who has ApoE4 gene can get Alzheimer easily. Why? Because ApoE4 gene is responsible for intensifying inflammation. Like if you have mild inflammation, it makes it severe inflammation. So if a person have chronic inflammation and this chronic inflammation affects the brain, we can expect that one day he will get cognitive problem and brain fog, and if he has Alzheimer gene, probably he can get Alzheimer. Also, it affects the mood and can cause depression. The inflammation of the blood vessels can accelerate atherosclerosis because atherosclerosis starts by inflammation in the blood vessel wall. It can affect the muscles and the joints, cause the person to feel fatigue and pain. And if you compare, if you're 60 years old and you compare your ability to move and mobilize to the time when you was in your 20s, you will see the difference. Also, the vitalization of the tissue lead to loss of the tissue vitality, and this accelerates aging, and this paves the road to occurrence of chronic diseases. So what we understand from this slide is chronic inflammation is very deleterious on your body systems. This picture is a simple explanation to what I have said. The organism secretes here, um, um, if the organisms are good, they secrete these three chemical substances. Most important is butyrate. Butyrate is very good. Why? Because it goes to the immune cells and it calms down inflammation. So this side, it goes to the brain and to the liver and calms down inflammation. If your gut microbiomes are good, but if the gut microbiomes are not good, they go into also the brain and the liver and all the body systems and create a state of chronic inflammation that I mentioned. Now, what is the importance of this? The gut microbiome here, if they are healthy, they are going to secrete these substances which calms down inflammation and works in the direction of helping your body to calm down its inflammatory process. However, if your body is having bad bacteria, these bad bacteria will secrete toxins and will secrete, and when it penetrates the small intestine and go into the immune system and create a state of chronic inflammation all over the body. Before going into supporting the gut microbiome, other causes of chronic inflammation are the root canal infections in the teeth or in the mouth. Root canal infection is usually hidden and long lasting, and the bacteria live long time in the root canals, and it can cause a state of chronic inflammation similar to that happened from the gut microbiomes. Like if we see here, this is the root of the teeth, and this is the cusp of the teeth outside. This is the gum. So here, this part is hidden. We don't see this part. We see only the tooth outside. So if this root gets infected by any microbe, it will live here for years. So it's very important to take care of the teeth. Another important source of chronic inflammation is chronic sinusitis, because the organism will live in the sinuses of the head. The sinuses are simply small rooms inside the bone of the skull. When the mucus lining of these rooms gets infected, it secretes toxins in the systemic circulation also. So you are exposed to toxins from the gastrointestinal tract, or probably from your teeth, or from the sinuses. These kind of infections, because it is lifelong infections, it creates a state of chronic inflammation. Now, we need to calm down inflammation of the gut. If you remember the previous slides, when we talk about the healthy bacteria here, which secretes this butyrate, this butyrate can be given as a supplement. This is number one information that I'm giving to you now. But instead of using supplements, if you eat green leafy vegetables, especially the fibers in the green leafy vegetables, these are very good food for the healthy bacteria. So one of the first message here is the green leafy vegetables. It should be part of everyday meal, because it contains fibers. In addition, the green leafy vegetables has many other benefits that we are going to tell about while we are going in this slide. If you need to use butyrate, it's available and it can be used. Also, sugar. The bad bacteria grows on sugar. So if you would like to kill your bad bacteria in the colon, you need to omit the sugar. This butyrate is a fatty acid produced by gut flora, means the gut bacteria, during the fermentation of dietary fibers. So dietary fibers are very important. There are other molecules like quercetin and luteolin. These are also can be used as a supplement. These can calm down chronic inflammation. So here I would like you to take note about butyrate and the quercetin and luteolin. Now, how to calm down inflammation? We need to know the source. First, the gut and the teeth and the sinuses. So about the teeth, don't ignore your teeth, please. And there is a system in the body called NRF2, nuclear factor 2. This nuclear factor 2 is responsible for stimulating the genes which are responsible for detoxification, removing the toxins from the body, including the toxins of the bacteria. So how I can upgrade this NRF2? We use the lipoic acid. Lipoic acid is famous for its ability to treat peripheral neuropathy in diabetes. However, it's very important for activation of the NRF2 to clear the toxins from the body. Also, the sulforaphanes. Sulforaphanes are present in the broccoli and the cabbage. And so if you add the green leafy vegetables and sulforaphanes, you guarantee here growing healthy bacteria, and in the same time you guarantee upgrading the NRF2. However, the lipoic acid in this issue is more potent than the sulforaphanes. There is another issue here that creates inflammation or help inflammation. This issue is the glutamate versus GABA. What is glutamate and what's GABA? Glutamate is, both of them are chemical transmitters in the brain. The glutamate is responsible for the fight-flight reflex. Fight-flight reflex action is when you are exposed to a threat that probably threat your life. For example, a snake jumped out in the room. What you are going to do, you are going to escape very quickly. So you are using your sympathetic nervous system, you're raising your adrenaline and cortisol in order to escape. However, the GABA is the calming chemical transmitter. It acts opposite to the glutamate. So we need always to work with our GABA and reduce the activity of glutamate. Why? Because now the life is very stressful. Stress from work, stress from lack of money, stress from marital life. So our life now is very stressful. Even if you're driving in the road, you are under stress. So meditation is very important to calm down, and the prayers. Also, progesterone for ladies in the perimenopausal state, because progesterone is a direct stimulant for the glutamate, and it relaxes it relaxes the body of the lady, and it helps with the sleep because it has effect on glutamate similar to effect of Valium. However, not every progesterone do this role. We mean here the micronized progesterone or the natural progesterone, not the drug progesterone or the artificial progesterone. The drug progesterone, we call them progestins, not progesterone. If you're confused, if you find on the box the word progesterone written alone, this means that this is the natural progesterone. If you find the word progesterone among other words, this is artificial progesterone. So we need the natural progesterone, because the artificial progesterone works opposite to the work of progesterone on the glutamate and the GABA receptors. In addition, it has many side effects, and we cannot use the artificial progesterone more than 3 months. However, the micronized progesterone, it can be used for life without any problem. And it also protects against breast cancer and the endometrial cancer. Also, we have genes. Some genes I spoke before about genes. Some genes control the amount of chemical transmitters, like control the amount of adrenaline that are secreted in the brain. If the gene is slow, the gene that destroys the adrenaline after its secretion, if this gene is slow, this means we will have large amount of adrenaline in the brain. The brain cannot get rid of this adrenaline, so the person is in a state of agitation. Anything can trigger him. However, there are ways to calm down genes. We will go to this later on. So the supplements, there are the quercetin and the luteolin. These are anti-inflammatory supplements, and the use of fibers and the greens for the sake of the gut microbiome or the gut bacteria. There is a resolving pro-inflammatory mediator. This substance is made from the omega-3. This substance called RPMs, they are manufactured in America and in Europe, but it's hardly found in Arab countries or in the Middle East. People use it to quickly calm down inflammation. So somebody will say, okay, why didn't we give Brufen or Voltaren to calm down inflammation? Okay, this is okay, good idea. However, we cannot use it for years. So these things that I mentioned, the quercetin and the luteolin, use of eating greens and fibers, this can be a lifestyle, can be added to your everyday life, but you cannot go on anti-inflammatory medications for life, and you will be exposed to the side effects. Now we will talk about the second part. Here is detoxification, how I detoxify my body. I have a special video before this one, but in Arabic language. about detoxification. However, I'm going to summarize it here. The toxins damage the proteins and impair mitochondrial function. The mitochondria is the place of production of energy. And if this mitochondria is destroyed or become weak, it will not be able to create the needed amount of energy that's required for all vital processes in the body. Now, what about the toxins? We have internal toxins, the toxins that are created inside your body, like in the gut from gut microbiomes and from the tooth bacteria or teeth bacteria, and from sinuses, from chronic urinary tract infection, and from mold. In Europe and America, mold exposure is very common. So these toxins remain in the body for years and impair the function of the mitochondria and make it sick. The external toxins are huge. We are living in a milieu of toxicity from heavy metals like mercury, arsenic, and cadmium. The mercury is mainly found in the fish and especially the big fish. Small fish which live for a long time, they are not does not have big amount of mercury, so you can eat small fish safely. However, the big fish like swordfish are very full of of mercury, and mercury is brain toxic and toxic to the mitochondria. Cadmium is present in the cigarettes, and arsenic also is present in around us in many things. The cans, if you are a person who like to drink from cans, the cans is fluorinated, and these are toxins. Even in the carpets they use flame retardant to reduce the susceptibility of the carpet to get burned. And we walk barefoot on carpets, and this also come into our body. Even deodorant, body sprays, all these contain toxins. Plastics. Now all of our food are put in plastics. Even greens are put in plastic. Our bread put in plastic. You buy something from the supermarket, you put in plastics, and plastics contain toxins that work like estrogen in female, which is very toxic if it goes beyond the normal limits. And if you check your estrogen level, it will not come in the measurement because it have molecules similar to estrogen or work like estrogen but not estrogen. So these are the toxins. Now, how we need here to know. I spoke about inflammation. Now I need to tell you a very important piece of information. If I need to do detoxification to my body, and in the same time I have inflammation, the inflammation will not give me a chance to do the detoxification. Why? We will see here. We know that detoxification happens in the liver. The liver expels its toxins to the intestine, to outside. So in detoxification process, we have two things we need to detoxify: the toxins from bacteria or the toxins from the heavy metals. These two go to the liver, and the toxins from the bacteria needs to be oxidized first. Why? Because after oxidation, it will bind to a binder called glutathione. Glutathione, after oxidation of these toxins, it becomes very toxic. That's why in the second step, it needs glutathione to attach to these toxins. Now it's not toxic, and it became water soluble. Before oxidation, it was not water soluble. When attached to glutathione, it become more water soluble and become less toxic and easily excreted in the feces or in the stools. Now, glutathione, this is GSH, is the abbreviation of glutathione, will give hydrogen ion, will give electron to the toxin to calm it down and prevent its toxicity. Heavy metals does not need oxidation when it comes to the liver. It binds immediately to the glutathione. So glutathione here has role in neutralizing the toxins of the bacteria and in neutralizing the heavy metals. However, there is an enzyme called glutathione peroxidase. This enzyme uses glutathione to do its work. What is its work? It is a cofactor that reduces hydrogen peroxide. The toxins that come to the liver secretes hydrogen peroxide or has hydrogen peroxide in its composition, and the glutathione is consumed by the glutathione peroxidase, which will prevent the hydrogen peroxide from doing damage to the liver and to the body. So the glutathione peroxidase is important for detoxification of toxins. If I have too much toxic load from inflammation, I will not have enough glutathione to work with the heavy metals. So glutathione peroxidase consumes the glutathione, and it will not give a chance to glutathione to work with heavy metals. That's why the heavy metals will remain sitting in the liver till they find enough glutathione. So one of the most important steps of detoxification is to treat chronic infections first. Now, this is the process of detoxification. First, when the toxin come to the liver, it first undergo oxidation by enzyme called cytochrome P. Next step after oxidation, it conjugate or attach to one of three molecules. The most important of it is glutathione peroxidase. And if it is not a toxin, if it is a heavy metal, it needs the glutathione itself to reduce the heavy metal and make it non-toxic. So if I consume the glutathione in the glutathione peroxidase, I will not have enough glutathione to neutralize heavy metals. After that, both of them will get excreted from the liver. And after excretion of the liver, it will go into the stool. However, if there is no binder to bind the toxins in the intestine, it will get reabsorbed and circulate again in the circulation, like we did nothing. All this heavy work done by the liver to oxidize the toxin or to attach to the heavy metal, and all of these go to the intestine, they will not go into the stool outside the body. They will get reabsorbed again if there is nothing to bind to these toxins or the heavy metals in the intestine. So charcoal is very good for binding toxins, while zeolite is very important or very clever in binding the heavy metals. So taking charcoal every day with zeolite can bind the toxins and the heavy metals. Okay, now the heavy metals and toxins are staying in the liver in big amount, and they has special gates to go out with the bile into to the intestine. These gates can open by certain substance, usually the bitters, like the myrrh. Myrrh is known in Arabic as murra. And if you take myrrh and after 1 hour you take the charcoal and zeolite, this will allow the toxins to be expelled from the liver and get bound in the intestine. What is the BC? The BC is phosphatidylcholine. It's also one of the things that are sold and you can buy it. The importance of phosphatidylcholine is it keeps the bile fluid not thick and easy flowing, and in the same time it enter in the formation of all the membranes in the body. So it strengthens the wall of the gallbladder and the biliary system inside the liver, and also is important for building the mitochondrial cell wall. So in detoxification, what I mentioned here and the important is glutathione. Glutathione is very important. You can supplement with glutathione, and you can take the myrrh and phosphatidylcholine, and after 1 hour you can take charcoal and zeolite. This can be part of your lifestyle. You can do it to find effect. It needs at least 6 months. However, if you make it part of your lifestyle, you guarantee that your system will become clean. Now, we will go to the third part, is energy production and the reversal of aging. As we know, our body works with energy, and the energy name in the body is ATP. The molecule responsible for energy is ATP, adenosine triphosphate. However, this adenosine triphosphate is manufactured in the mitochondria, which is the powerhouse of the cell. It's created from another substance, very important. We will go to it now. Its name is NAD. This NAD or NAD is the pacemaker of the mitochondria, the most important molecule in the body, because it facilitates, or it is essential to make energy from the mitochondria. How it make energy from mitochondria? This is very scientific, very detailed. However, you need to know that NAD is very important for production of energy. So if you're suffering from fatigue and laziness, probably NAD supplementation can help to create ATP. Also, NAD do many other important things, like activation of the sirtuins. Sirtuins, now I need you to keep in your mind the word sirtuin. These are some chemical substances, especially SIRT1, that are essential for repairing the defective genes in the chromosomes. As we age, the genes become distorted and become dysfunctional. So God created this sirtuin in order to go and check and repair the defective genes. This sirtuin consumes too much from the NAD. That's why if the sirtuin is active, and it will reduce the amount of the naturally produced NAD. So supplementing with NAD will help you for energy production and for stimulating the sirtuin. It also enter in the formation of the brain neurotransmitters. People who suffer from brain fog or lack of concentration, the NAD will help. It helps also to repair the DNA by activation of something PARP gene. This PARP gene also like sirtuin, however the sirtuin is much more powerful. It aids in chromosomal stability, and it is involved in the immune system signaling. So this NAD is very vital for the body for these two reasons: production of ATP and the longevity. Now, what is the SIRT function? Now I'm going to speak about the longevity or the sirtuin. What sirtuins do? Here is the NAD, the important molecule. It stimulates the sirtuin. What does the sirtuin do? The sirtuin do go to the DNA. It is stimulated when there is damage by the damage in the DNA or in the genes. The SIRT1 recognizes this damage and go to repair it. However, if you don't have enough energy, if you don't have enough NAD, this sirtuin cannot do its job. Here, the sirtuin can block this. This is block the UCP2 and reduces insulin secretion, so it improves insulin sensitivity. And also it blocks the P53, so it blocks the tumor genesis. It prevents formation of tumor and cancer. Also, it blocks the NF-kappa B, which is an inflammatory mediator, so it reduces inflammation. Also, here it stimulates the BGC1 alpha. This is responsible for creating new mitochondria. And creation of new mitochondria is very important. This is the secret how we become young again. So the SIRT here do is a very important role, is correcting the damage of the DNA and reducing the inflammation, and it creates new mitochondria. What it needs for all this? It needs NAD. Now, this is again the action of sirtuin. Now, how I can preserve the NAD? This is also important. So we know from the previous slides a molecule called NAD. It can be taken also as a supplement in the morning. It will do all the benefits that I mentioned before. Now, this NAD is here. This NAD comes from niacinamide. Niacinamide or nicotinamide. This is nicotinamide. Nicotinamide comes from nicotinic acid. It's vitamin B3. So vitamin B3 becomes niacinamide or nicotinamide. This nicotinamide can come here and become NAD. But before it becomes NAD, it creates a molecule called NMN. This molecule is very important. However, the conversion of NAM to NMN, this nicotinamide to NMN, needs this enzyme. This enzyme is very important because its activity is declined with age. As we age, this enzyme become impaired and very slow. So the nicotinamide, which we can take as a supplement, or B3, vitamin B3, which is nicotinic acid or niacin, cannot become NMN. And as a consequence, you cannot make enough NAD. What makes the problem worse is accumulation of this nicotinamide. It suppresses the SIRT. So this is the SIRT here. When this niacinamide accumulates, because it's not converting in this way, it's not converting to NMN, it suppresses the sirtuin, and you lose all the benefits of the sirtuin or the SIRT gene. So in order to make too much NAD or enough NAD, you need to have this gene active again. This is very difficult to do. So what is the solution? The solution is to give NMN. And the NMN is now available and it can be taken as a supplement. So you have two choices, whether to take NMN, which will convert to NAD, or you take directly the NAD. The NAD is given intravenously. Nowadays, they make sublingual NAD, but it's not available everywhere. However, the NMN is available and it can be used to get all the benefits of NAD because it converts to NAD. So here the enzyme that I was talking about, which is reduced by age, it's reduced by age and reduced by inflammation. And as you understand now, inflammation can accompany aging. If you have chronic gut microbiome problem or chronic sinusitis or chronic teeth problem or chronic infection, Aging and inflammation and ischemia and degenerative conditions all block this enzyme. That's why, many factors can make this enzyme not working, and the NAD cannot be formed. Now, we will go now into how to activate this SIRT1 without giving NAD. While giving NAD is important, giving NMN is important, we can activate this SIRT1 by other tools. We have here 3 pathways in the body that can help in activating the SIRT1. The first pathway, in order to understand this drawing is easy. This is the sensor. We have 3 sensors in the body that senses energy. So if you have too much energy, these two, AMPK and the SIRTUIN, will not work. However, if you have too much energy, this mTOR will work. So if you have restricted energy, like during fasting, you activate the AMPK. If the AMPK is activated, it will activate the SIRTUIN. So this is the second thing that can activate the SIRTUIN, is the time restricted eating or intermittent fasting. Time restricted eating is you stop eating for a period of time of a few hours, while intermittent fasting, you can fast for 1 day or 2 days. So both of them express that you will need to go into a state of partial starvation. So the AMPK becomes stimulated, and it will stimulate the SIRTUIN. Stimulation of the AMPK and the SIRTUIN, the net result is autophagy. Autophagy means that the cells eat the dead organelles or the weak organelles inside the cell. And these weak organelles include the mitochondria. So the old mitochondria get eaten, and its proteins and constituents are recycled for the formation of new mitochondria. The mTOR here, it activates when the calories are too much. So the mTOR, if you eat too much, it helps with fat accumulation, and it works opposite to the effect of AMPK. Now we will come to the area of epigenetics. Epigenetics means if you have, for example, a recipe book, a book which contains the prescription for how to make a meal, you can select from this recipe book which recipe you need to use in order to make a meal. And for example, you can make 100 different meals from few recipes. So the genes here are the book, and what you are going to make from this book, what you are going to use from this book, what you are going to activate from this book, is the effect of the epigenetics. So it is the environment, effect of the environment and lifestyle on your genes. In order to understand it more clearly, they found that if you have identical twins which have exactly similar genetic makeup, however, one of the twin live in a healthy environment and another twin live in unhealthy environment, the person who live in healthy environment live long life, healthy, vibrant, and the person who live in unhealthy environment become overweight and obese, and he gets diabetes. This is what happens here. What happens here is the environment, what you eat, the activity level, the pattern of your sleep, how you think. All these factors can activate certain genes and deactivate another genes. So the factors that affect the epigenetics are the diet. Like if I'm, as I mentioned before, for example, if you eat sugary diet, this means you are activating the microbiomes, the unhealthy microbiomes, creating inflammation. This inflammation go to certain genes, the genes responsible for inflammation, and activates it, and also activates the formation of obesity. If you are physically active and you eat fibrous diet with lot of green leafy vegetables, this means you are going to stimulate the genes of health. You are providing your body with the milestones needed in order to stimulate the health responsible genes. If you're fasting for enough time, you are activating your sirtuin and you are correcting your genetic makeup, and you will not be prone to chronic diseases. Now, what happens here in the genes in order to understand? In order to, there are, this is another topic related to the previous topic, which is the epigenetics, but this one is concerning the gene itself. The previous one, we were talking about what affects the gene. In this one, we are talking about the gene itself. Some genes, uh, the gene is consistent of four bases or four proteins. These proteins are A and T and C and G. Only four. Always the C bind to G, and always the A bind to T. And this one is phosphate you can say this phosphate backbone of the chromosome. And here is one base attached to another base. There are three bases here, three pairs of bases. However, as you see, G is attached to G, always like that. If we consider this one is a normal gene, this one we consider it the normal gene. Sometimes a pair of these base has become replaced. Instead of G, C, it become A and T. This change the strength of the gene. So if this gene is responsible for secretion of dopamine in the brain, and or it's responsible for the enzyme that destroys dopamine in the brain, and this gene becomes defective like this one and become less active, this means the adrenaline or dopamine will stay in the brain for a long time, because the enzyme that is secreted by this gene, the amount of this enzyme become less. And in the same time, a replacement of this A and this C and G and C replacement by A and T can also increase the activity of the enzyme responsible for destruction of another chemical transmitter, for example, serotonin. Serotonin is the chemical transmitter of happiness. So if the enzyme destroys that serotonin quickly, this means the serotonin level will become less than normal and you will become prone to depression. Understanding the genetic makeup here can help us to support the system with the molecules that can create in the system the deficient chemical transmitter, or can give us tools to accelerate the clearance of excessive chemical transmitter. Here comes the genetic testing. When we do the genetic testing, we identified what we call SNPs. This SNPs is what I mentioned and what I explained for. If two pairs are replaced by another two pairs. The first one here is the normal or the optimum genetic makeup. The second one here is the defective genetic makeup. For example, here I'm going to explain one gene which become not functioning well. I'm going to continue with this presentation in the next section, because this video now become too long, and I want you to take notes, or you listen to the video again to take notes about what I have mentioned. And after that, I need you to, if you like the video and you find it informative to you, you like the video, because if you like the video, you know, it will rank up and other people can see also. And see you in the next video. Thank you so much.